Channel 5 Plus.
From the News Channel 5 Network, this is the Takacs McGinnis Elder Care Law Hour.
Welcome to Takacs McGinnis Elder Care Law Hour, where we explore the many issues due to aging, disability, and unexpected illness. I'm your co-host, Tim Takacs, and today we're talking about the not-so-golden years for seniors. In the past, we've talked about seniors, their golden years. However, for many seniors, it's not so golden. Unexpected illness, low-wage jobs, health issues, and basically not so good planning has created problems for our seniors.
And I'm Barbara McGinnis. In today's show, we're going to particularly be talking about resources and organizations that help resource and income challenged older people. What if you have a loved one or you yourself are having care issues or health care problems? Gretchen Funk, the Associate Executive Director for Supportive Care Services with 50 Forward's here with us to talk about some of their programs. Welcome, Gretchen.
Good morning.
Good morning. A lot of people probably know 50 Forward and their active adult, senior adult programs, their centers, but you've got a lot of services that people don't know about. And one of those is, I think it's called Living at Home Care Management.
Right.
Tell us more about that.
Sure. So 50 Forward, our mission is to support, champion, and enhance life for people over 50 in Middle Tennessee. So all of our programs have that aim. Our Living at Home Care Management program has been in existence for about 3 decades. Wow. So the mandate of that program is in Davidson and Williamson counties to work with, as you said, under-resourced older adults. So people whose incomes are at 200% of federal poverty level or below. So for an individual, that translates to about $2,023 a month in income. So for those folks, there's no cost to them for our services. And we provide a care management model of service. So with all of us, until we have a problem, we don't know what resources are out there to help us with a problem. And for seniors especially, there are barriers to getting in contact with services. Some of the things that make them in need to begin with: lack of transportation, lack of support from their families, isolation. So our care management program, folks come to 50 Forward through many different means, and then care managers will go out and meet them in their homes, break down that barrier to getting to the service, and then we do a comprehensive assessment. So a senior might come to us and say, here's my problem, and we'll say, sure, we'd like to help you meet that need, but let's look at all these other things so that you're not waiting for the other shoe to drop around needs for folks who have that low income situation.
So I guess what I think the term now that's used is social determinants of aging.
Absolutely. I was just talking with folks about that yesterday. So everybody, almost everybody wants to remain living at home, but there are many things that can get in the way of that. Like you were saying, health needs, certainly financial constraints, social supports available to them. So that is absolutely the sector where we operate around those social determinants. What do they need access to? Their medications, to medical care, to healthy food, to secure and safe housing. So our care managers work to be sure that all that can be in place.
Right.
Yeah.
Does it cost? How much does it cost the senior?
There's no cost to the senior. There's, of course, a cost to the program, and we are fortunate to have grant support. Almost all of 50 Forward's programs are also heavily supported through charitable donations.
Right. So is it no sliding scale? Or?
So within 50 Forward, we have sliding scale care management and fee-for-service through our care team program, but the Living at Home program in particular has no cost to these seniors who have that 200% of federal poverty income or below. Yep.
Is that something that's only available in the Davidson County area, or do all of the 50 Forward's locations?
50 Forward operates in Davidson and Williamson County, so this grant-funded no-cost program is just Davidson and Williamson County. But the sliding fee and fee-for-service we offer in contiguous counties.
All right, but that's not the Living at Home Care Management program. That's different programs that you have.
Right.
Which I think one of them might be an adult day services program.
We do. So adult day service is a model where older adults, in our case, who are living in the community with their families perhaps, or in group home settings, they cannot remain safely home alone during the day. So they can come to our center, which is located in Green Hills, a very convenient location to folks who might be going to work downtown. They can come as early as 7:30 in the morning, drop off their adult loved one. The older adults that are with us, almost all of them have a cognitive impairment. Some are very physically frail because their age is very advanced, so cognition is not so much the issue, but just being able to safely navigate home alone during the day is not possible for them. So they can come early in the morning, stay till 5 o'clock. We have all kinds of programming throughout the day. People come in from the community to engage in programming. So really a place where folks 50 to 95 is our oldest individual right now, can form friendships and have that supportive environment that we all would like someday.
But age qualifications is as young as 50.
Yeah, exactly. And most of our folks fall in the 65 to 95 kind of age range, but some folks affected by strokes and other things are definitely younger. Yeah.
Right.
Okay.
So as long as you meet the, is there an income test for that as well?
Question about
for the
that.
adult day services?
Right. So that program is a mixed model. We do have social services block grant federal funding coming through the state of Tennessee that supports attendance for about half of the individuals. We can accommodate about 32 folks there. So for those individuals, there's no cost to them to come to the program. Their incomes have to be very low, $1,250 a month or below. Other than that, we offer a sliding fee up to $65 a day is what we're charging now. So that's also neat because you have a mix of folks from all different backgrounds who maybe would never have come across each other and now are enjoying their day together, being supported.
Right. All right, so let's talk about the Meals on Wheels program.
Sure. So our Meals on Wheels program operates out of Green Hills also, and the way that Meals on Wheels works in Davidson County is that Metro assigns you a catchment area. So we have a really funky catchment area that includes the Green Hills area, Belmont area over by the fairgrounds. So every day about 10 volunteers come in and deliver meals to about 80 older adults per day. We serve about 135 folks through that program every year. Most of those folks, 80% of them, there's no cost to them for their meal. Again, they fall under that 200% of federal poverty level or below. The other 20% of folks, they can purchase these meals. They're healthy, nutritious. We entered a partnership with the Nashville Food Project last year where we made our own meals since 1969, but now there's this community partner. So we can continue to serve seniors and we can get these healthy meals from.
So tell us what those meals are.
Okay, so what they look like, and the meals are also served to the adult day service participants while they're there. So we are really looking for nutrient-dense meals. So the idea is that as you get older, you don't need to eat as much food, but every bite that you eat needs to make a difference for you. So there will be a protein component to it. Vegetables and fruits are something we really focus on. So fresh salad, fresh fruit salad, maybe it'll be a fish taco or a beef stroganoff kind of a meal. But beautiful meals coming to us from this other not-for-profit partner in the community.
Great.
Yeah.
What about eligibility requirements? And tell us about the waiting list. I bet there's a waiting list.
You know, we are very fortunate. We do not receive any federal funding for that Meals on Wheels program. Sometimes people think Meals on Wheels is completely funded through the government. It is not. We do receive, gratefully, some funding this year from Metro Nashville, city government for that program. So in order to qualify, again, 50 and over, functionally homebound, so have a real barrier to making meals for yourself, getting out to get food for yourself, and then in order to not pay a cost directly, under 200% of federal poverty level for that income, which is about, again, that $2,023 a month for an individual.
Yeah. Gretchen, we just have about a minute left, so tell us a little bit about how to get in touch with 50 Forward if someone needs help, whether it's the Meals on Wheels program or I think you've got a program called the National Foster Grandparents Program,
which is a beautiful program.
Right. So tell us about how people can contact you.
Great. So we have a beautiful website, 50forward.org. There are tabs for each of our programs there. There are different phone numbers for each program, but you can also call our main phone number, and our folks will get you the place you need to be. And everybody that you reach at 50 Forward is going to try to get you to the right place.
Okay, so the idea is that it's like a one-stop shop.
Exactly. Yep.
Because you've gone through a lot of complicated things, I think it sounds like, about you qualify this, but
but
sure
we'll know
make that phone call.
Absolutely. Thank you.
Great.
Great. Yeah.
Thanks, Gretchen.
Thank you.
All right, so it's time for a break. When we return, we'll come back and we'll be talking about housing for low-income seniors. So stay with us.